Hello, my name is Patrick Brown, Mayor of Brampton, and welcome to our weekly COVID-19 update on the city's efforts to combat COVID-19. I'm joined this week by Regional Councillor Martin Medeiros, who is chairing our working group on the reopening of the city, and Dr. Lawrence Lowe, who is our Medical Officer of Health in Peel Region. Welcome to Stage 2, Brampton and everyone in Peel Region. We are encouraged by the provincial permission to move to the next stage of reopening, encouraged by the declining number of cases in Peel Region. So today, patios will be open, hair salons will be open, and I know a lot of people have been waiting for this day, and certainly it's good news for our community. And thank you to everyone who have been doing their best to maintain physical distancing and wearing masks. We've got some more good news this week. Following the province's announcement that day camps are permitted to operate on Stage 2, our Recreation Department has been working towards this announcement, and I'm pleased to announce that the City of Brampton will be offering modified summer camps starting July 13th for ages 4 to 10. Camps are a special time for children, an exciting part of the summer. During this time of isolation, it is even more important for children to stay active, learn new skills, and have a safe place to play. So we're creating a safe environment during COVID-19 for our youth in Brampton, children in Brampton, to be able to attend camps. Registration opens on June 29th. Camp programming has been modified, so there's going to be more individual activities, more outdoor activities, and I should note, everything we do in camps in Brampton, health and safety is going to be a focus, and we've taken some initiatives to ensure that. Personal protective equipment will be worn by all those working in the camp setting, all the camp leaders, the instructors. I should note the camps will be in groups of a maximum of 8 participants. In addition, there's going to be frequent cleaning and disinfecting that will take place in all facilities. In addition, summer camps will be reopening with the following amenities. There's going to be a portable hand sanitizing stations available in all high traffic areas at the facilities that are opening to accommodate these camps. I should note outdoor basketball courts will be available for training starting June 26th, not team play yet. That's not permitted under Stage 2. On June 27th, our splash pads will be open to the public. I know there's a lot of families who've been waiting for that, especially with this summer heat. Arenas will be open for training use starting on June 29th, and bookings will begin on June 25th. There'll be no access to change rooms and the maximum of 10 participants, which includes the coaches. On July 3rd, sports fields will be available for permitted use by affiliates and major user groups in the city. There will be no more access to change rooms on our sports fields, and a maximum of 10 participants as well. So this is following the provincial protocol that training is allowed, and we're trying to make sure that residents can continue to stay active in the sports that they love in our community as we adapt to COVID-19. Professor's Lake, which I know is a really popular spot in Brampton. Sometimes we have upwards to 2,500 people attending a day during the summer. That's going to be opening soon as well. We're just working on ways to ensure physical distancing, and as soon as that's finished, Professor's Lake will be open hopefully in early July. I know a lot of people have asked about garage sales. Even my own mother has asked about garage sales. Garage sales are now permitted. Maximum of 10 people, and that includes the homeowners, but garage sales are now permitted in Brampton. For more details on all of these openings, you can go to brampton.ca. I also want to thank residents. In the height of this pandemic, we had to lay a lot of charges for people that were not abiding by physical distancing. And I continue to see a decline in the amount of charges that have to be laid. At one point, we were, 120 plus charges in a week. This week, we were down to only 17 charges. And so I think the vast majority of the city continues to appreciate and understand the seriousness of this virus, and we have to listen to the advice of public health. So for everyone who continues to take the advice of public health seriously, I just want to say thank you on behalf of the city of Brampton. I also wanted to speak today to testing. I've been so proud of the Osler health system. As you know, Osler Health covers the territory of Brampton and Etobicoke. Last week I mentioned that they were among the top testing hospitals in the province. I think it's Brampton and Ottawa that continue to fight for number one, who's had the most COVID tests in the province. Testing. It's so critical. It's a way to know where the virus is. And the fact that testing has been so high in our community is just a key tool to combat this virus. And I want to thank everyone that continues to go forward to get tested. And I should note, as of today, the Osler Health System has tested over 61,000 people. Just incredible. Thank you, Osler Health, Dr. Naveed Mohammed, for your leadership on testing. As you know, the City of Brampton did a specific partnership with Osler Health to have testing available at our South Fletcher's Community Centre. We've opened it up to allow for that testing. It's a drive-through testing. It's a unique partnership with the city and the hospital. And I can tell you, just in the last week, we had 4,361 people get tested at South Fletcher's. So that's another encouraging sign. 560 people were tested just yesterday. And we are going to be having another pop-up testing center at Gore Meadows on the Gore Road in Brampton from 10 a.m. to 8 p.m. on Friday. And so if you haven't got tested, please get tested. It gives us an indication of where there's risk, and it's going to help us as we fight this virus. So thank you to everyone that got tested, and thank you to Osler Health for their leadership on testing. I think it's starting to stand out in Ontario that we've got an incredible health team at Osler Health, and that 61,000 tests, very impressive. So on that note, I want to introduce our Medical Officer of Health, Dr. Lawrence Lowe, to give an update on our progress as we fight COVID-19 in Brampton and throughout Peel Region. And as always, I'm grateful for the tireless dedication of Dr. Lowe and his dedication to public health in our city and our region. Dr. Lowe.
Thank you. Good morning, Mayor Brown, Councillor Medeiros, colleagues, and good morning, Bramptonians. As of today, Brampton has seen 3,145 cases of COVID-19. 2,746 have recovered, 312 are active, and 87 Bramptonians have lost their lives. Also, as of today, Brampton and the region of Peel are entering stage 2 of the province's reopening framework. Though this is a significant milestone, I want to be firm. Heading into stage 2 is removing restrictions. It is not returning to our old ways. We are moving forward into a new normal, not backwards to the way things were. COVID-19 still circulates in Brampton, waiting to capitalize on a moment of weakness. Please continue to remember the 4 core behaviors to reduce risk. Stay 2 meters apart from people not in your immediate social circle. Wear a non-medical mask when you cannot. Wash your hands frequently. And if you are sick, get tested and stay home. Every Bramptonian must stick to these 4 core behaviors to keep us moving forward. Everyone, wherever you might go and whatever you might do. Every owner and operator must follow a COVID-19 reopening plan based on provincial guidance. And you can visit www.peelregion.ca/coronavirus to learn how to put a plan together. Planning and implementing precautions will encourage the core 4 behaviors and protect your staff, visitors, and customers. I also urge Bramptonians to consider being parsimonious in their interactions. Do not join large crowds. Respect social circles of up to 10 close contacts that stay exclusive to one another. Respect social gathering limits of not more than 10 people that stay physically apart 2 meters. And finally, track your interactions as much as you can. For individuals, a journal or a diary may be helpful, and for venues, an appointment book, a reservation list, or a visitor's log. That information will be vital for contact tracing should we in public health need it. On that note, yesterday marked Peel Public Health's 150th day in emergency operations. Since January 23rd, our team has worked around the clock to contact trace, investigate exposures and outbreaks, and keep you informed. And while we did our work, when we needed your help, you stayed at home and stayed apart while our first responders, our hospital and healthcare partners, and our essential workers kept our community moving. The results are clear. Fewer cases in our community have been seen overall, which means less severity and fatalities. We have averted a worst-case scenario. Our hospitals were challenged but not overwhelmed, and tragedy did strike in parts of an already challenged long-term care sector and in workplaces that went forward in the first phase of reopening. Those tragic outcomes were the result of long-standing disparities that left many groups vulnerable and impede efforts to achieve health for all, even in the best of times. However, it's important to remember that those disparities lay beyond the control of our immediate response. This means that while we do grieve for the impacted, the late-breaking story that you haven't heard on the CBC is that Peel Region and Ontario have also averted the worst-case scenario in our community. Our story is one of success and in turning the tide, and we did that together, Brampton. But I want to be absolutely clear, we are not done yet. As we move to stage 2, COVID-19 still lies in wait, and any momentary lapse threatens that success. One slip can result in transmission, which can result in a cluster that might turn back our reopening altogether. And I'm certain that nobody, absolutely nobody, wants to see that. So I repeat, as we move forward, I call on residents and businesses to do your part. Take the core 4 behaviors and precautions seriously, help reduce risk and stop transmission, and ensure that we will continue to move forward. Thank you, and I'll pass it back to Mayor Brown.
Residents of Brampton, please listen to Dr. Lawrence Lowe. He's an expert in the field of public health, and he only has the best interest and health of our region at hand when he gives us advice. Next up, we have Councillor Marta Medeiros, who has taken a leadership role for the city on the safe reopening of services. He is the chair of the working group on the reopening of the city. Councillor Marta Medeiros.
Thank you, Mayor Brown. Good morning. The province of Ontario on Monday recently announced that Peel Region can move on to its second phase. This was very timely considering that the City of Brampton's reopening working group just concluded its public consultations, which included consultations with seniors, youth, sports groups, businesses, arts, and culture. Brampton residents provided 4,500 online surveys, providing opinions, guidance, and expressing concerns about how City of Brampton would move on to its next phase. Stage 2 is welcoming news for our restaurants, businesses, personal care services, and shopping malls. So it's important that we be very careful and be very cautious in our approach. As the mayor reiterated, as the mayor talked about the opening of various services at the City of Brampton, I just want to remind everyone and reiterate that the Brampton Farmers Market, the splash pads will be opening up on June 27th. The ice skating arenas will be opening up on June 29th. Our outdoor facilities, sports fields, will be opening up on July 3rd. Again, a maximum of 10. Summer camps for ages 4 to 10 will open up on June 13th. As patios reopen, the City of Brampton has launched the Patio Brampton Program, a temporary patio extension program that will allow and make it easier for Brampton businesses who would want to expedite the process to extend their patios. This is important as we want to process the applications in a quicker manner to help businesses who are struggling. While accessing the facilities and services that the City of Brampton will now open up, I encourage you to keep practicing the safety and hygiene measures that Peel Public Health has advised. This will help us work towards entering into phase 3, where more workplaces and community spaces can open up. July 1st is around the corner, and we are excited for what's in store for Canada Day. Our celebrations are going virtual beginning at noon. Celebrations include kits, an interactive dance party, trivia games, and more. The Electric Digital Stage will have performances from local artists, Family Splashin' Boots, headliner Juno Award-winning Walk Off the Earth, and at 10 p.m. we cap off with an evening of virtual fireworks by Tim Hortons and powered by Snap Hub. Finally, I would just like to encourage everyone to support local, but ensure to maintain social distancing and practice good hygiene. Thank you.
Thank you, Councillor Marta Medeiros. It's now time for questions, and I see the first question is Graham Frisk from the Brampton Guardian.
Hey, Mr. Mayor, how you doing?
Good.
Okay, so I'm just wondering, what are the local contingency plans should we see a spike like we're seeing sort of in the States right now in Florida and Texas, and then like what would be some of the local, I guess, plans as to what would come into effect?
We've taken a very cautious approach in Peel Region. As you know, we delayed the reopening. We were the first in the GTA to make masks mandatory on transit, second only to Ottawa and Ontario. We've had strict enforcement with our bylaws, and we're making progress. But if for some reason we see a spike, some of these rules that have been relaxed could easily be reversed, and I'll let Dr. Lowe speak to that hypothetical situation. And I hope we're on the tail end of the first wave, and we're not going to see it come back. But you're right; we need to be prepared for all scenarios.
Thank you, Mayor Brown. Thank you, Graham, for the question. The reality, as you know, in March was we closed the community as a whole. Now that we actually have an understanding of the 4 core behaviors that we should be practicing and that businesses should be encouraging in order to reduce our risk, what would likely happen, and particularly with our ramped up contact and case and contact management capabilities, would be targeting closures more. So for example, rather than closing the whole community, it may be closing off a workplace, closing off an office building, whatever the case might be, similar to what you're seeing more in European countries and other countries in Asia that have gone before us. It is a very different context from what happened in the United States. I certainly, as I understand it, many of these states had not gotten over the peak of their first wave and had moved forward without a gradual reopening and immediately into an unrestricted manner, which explains what they're seeing. But I think where we are right now and the case and contact capacity we have right now would allow us to hopefully be more localized in closures should they be needed in the future.
Okay, great. Now, I know there was some concerns among the community about the protests recently happened. So I'm just wondering, have there been any new cases traced back to the protests, and where are the new cases coming from?
I'll let Dr. Lowe speak to that. I can tell you I attended one of the protests, and I was encouraged to see so many people wearing masks and trying to abide by the guidelines of public health. And I'll let Dr. Lowe speak to if he's seen any evidence of a spike in cases.
Thank you, Mayor Brown. Thank you, Graham. We continue to examine the data, and at this time, there is no evidence that the protests have led to a significant spike in cases in our community. Overall, as we've seen, the new cases in Brampton as well as in the region of Peel continue to trend downwards, and that I think speaks and is a testament to people being responsible and respecting the distancing, masking, hand hygiene, and staying home and getting tested if sick measures that we have recommended.
Okay, next up is we have Sumit from Omni News.
Hey, Mayor Brown, can you hear me?
We can.
Thank you for taking my question. So you said a couple of days ago that the 2021 Peel Police budget will be examined through a different lens. Following the tragedy in which Mr. Ajaz Chaudhry was shot and killed, I want to make a note that his family said that they told responders that he could not speak English. So sitting on the board, my question now to you is, in the planning and the steps that you look to take following this tragedy, will you make a conscious effort to hire and include people who speak some of the most common second languages in our diversity so that whatever solution the board proposes will be one which can serve its residents?
So I'm happy to speak to this. It's not specific to COVID that what this press briefing is on, but I'm happy to speak to it to say Mayor Crombie and myself have been active pushing for reform in policing. As you know, we put forward the motion asking for body cameras to create a greater level of transparency and accountability. That passed our board a number of weeks ago, and we're getting the final recommendations at our police board coming up this Friday. I'd also note, and I've said for a long time, even when I was in the provincial legislature, that you can't criminalize mental health. And we've started some initiatives to try to have a greater response of mental health workers to mental health moments of crisis. And obviously the incident in Brampton and in Mississauga was heartbreaking. We have to do better in these circumstances, and I'll be continuing to push for that as Mayor of Brampton. And in terms of, part of your question was on language, and if there's language barriers, obviously that needs to be adjusted. We speak over 110 different languages in Brampton. We're a mosaic of the world, different people, different faiths, different backgrounds, and the city communicates in our 10 most spoken languages, and there's no reason that we can't have mental health services and police services that are able to adapt to the multicultural mosaic that is Peel Region. Sumit.
Thank you, Mayor.
Okay, thank you. Don McLeod from Brampton Focus.
Gentlemen, many countries, as they open up into phase 2, many countries, cities are opening up. They're mandating wearing masks in public because that is the best way, according to health experts, to mitigate the spread of COVID-19. Why are we not mandating masks rather than keeping a diary?
So in the city settings, we are doing that. As I'll note, whether it's our camps where we're having, all our personnel wear masks, the farmers market where we've mandated masks, the Brampton Transit where we've mandated masks. In terms of private businesses, that would fall under the purview of our medical officer of health, and I'll let him speak to that.
Thanks, Mayor Brown, and thanks, Don, for the question. I'm reminded of the meme that says, well, why not both? I think you can do both, a diary and also adhere to the strong recommendation on the part of public health to wear a mask. Specific to a mandate, it is certainly something that I would support if our context and numbers dictated it. It's very clear that we are in the midst of the tail of the first wave at this time, and that the current measures, the current strong recommendation, has actually led to a significant uptake of the behavior as it stands. And I will make very clear that in the event that our numbers start to go in the wrong direction, if it's clear that we're having widespread propagated community transmission, then I would certainly be on board with considering a mandate. So it's for me, it's not a question of if, but it's rather a question of when. And at this moment, we do continue to have the strong recommendation that people wear masks and also keep a diary for contact tracing while they wash their hands and stay apart from others. So thank you. I'll pass it back to the Mayor.
Thank you.
Thank you.
Dr. Lowe.
Thank you. My second question is, the Federation of Canadian Municipalities asked for $10 billion to offset costs during COVID. The federal government has earmarked $2 billion to municipalities. How much of that money, if any, has been earmarked to Brampton at this point in time?
So the announcement of that $2 billion is no new money for Brampton or Canadian municipalities. That was a re-announcement of the previous gas tax transfer. That's something that's always been there. That doesn't provide any assistance to Canadian municipalities. The payment that was expected in the fall was simply moved up a few months. This is, the gas tax transfer has been something that municipalities have depended on for infrastructure over the last decade and a half. So it's disappointing that the provincial and federal governments haven't come to the table in terms of COVID-related expenses for municipalities. Mayor Tory in Toronto, Mayor Iveson in Edmonton, Valerie Plante in Montreal have been outspoken that this is a shortfall that needs to be adjusted. It seems every day there's a new announcement being made by federal or provincial governments, financial support for a different sector of the Canadian economy. I struggle to appreciate why they haven't decided to come to the table and support a frontline municipal essential workers. And what I'm talking about is our first responders, our paramedics. Obviously they need additional protective equipment. Public health workers that are funded municipally, our firefighters, our transit operators. We've had to adjust how we do transit with the glass barriers, the adjustments with personal protective equipment, our waste collection. These are all essential services that we can't stop. Municipalities don't have the ability to run deficits like provincial and federal governments do, and we can't be in a position where municipalities run out of money and these critical services have to be curtailed. I can't imagine any world where the Premier or the Prime Minister would allow the public health, the first responders budgets to run out during a pandemic. And so I do expect they'll come to the table at some point. Frankly, I think it's taken too long. There seems to be a lot of inner fighting between the two levels of government. The provincial government saying the federal government's going to come to the table first. The federal government saying the provincial government is going to come to the table first. They both recognize, I've heard this directly from the provincial minister of finance, I've heard it from the deputy prime minister. They tell me they both recognize they have an obligation to come to the table and help out. But boy, it's taking too long, and I hope they understand they have this responsibility. It would be unconscionable if the people who are at the greatest risk during this pandemic, the people on the front lines, if we were to curtail their budgets in the midst of a pandemic. It's just not something that I could ever imagine anyone in the public wanting to tolerate. Thank you, Don. Our next question is Nitin Chopra from Prime Asia TV.
Good morning, Mayor Brown. Thanks for taking my question. Mayor Brown, since you are in the Peel Police Board, so a few days ago we saw one viral video of burnout on the roads, which is a quite dangerous act. We know it's a police responsibility, but as a leader, why don't you write to federal or province to give severe punishment to these kind of culprits and these type of incidents which happen? We can save lives before anything happens, as we are still in shock for Caroline kids.
So I haven't seen the tire burning video that you're speaking of, and if that is in Brampton, I can ask the Peel Police about that. What I would say is there's zero tolerance on racing in our community. We're still shocked, hurt, deeply hurt by the tragedy last week where a family was, in a senseless manner, had their lives shattered, taken, robbed, stolen. A beautiful family. That's the consequence of reckless driving. And I can tell you the city of Brampton started on a program of putting photo radar in community safety zones. We've installed the first 5, but we're in a process of installing, it could be as many as 200 by the time this is over. If you speed in our community, you're going to get a big fat ticket. Do not speed in our community. There are consequences. And I want to thank the Peel Police who have been doing these blitzes on speeding. Just this weekend, we saw more cars impounded, people lose their licenses. We're taking it seriously. And if you're going to be an idiot, if you're going to be reckless in our community and speed or street race or drive impaired, you're going to face significant consequences. There just isn't tolerance for this. So thank you for the question, Nitin.
My second question is, in the recent rallies which we saw in the Peel or in Brampton, we saw those rallies, no social distancing guidelines were being obeyed by the protester or by the ralliants. So if the pictures are there in the front in social media everywhere, we have those videos, can bylaw issue tickets to them also, those who don't follow those kind of guidelines? Because from province, it's only 10 people allowed.
So I went to one of the protests and I noticed that the vast majority of people were wearing masks. I was encouraged by that. This is an important moment in our history where we're confronting systemic racism. And if you look at the crusade of Trustee Cathy McDonald, it's been successful. How she's exposed systemic racism in the Peel schools. The province has stepped in, appointed a supervisor. There's been a significant change just this week because of her courage and determination. I'm proud of her passion and her persistence. This is much needed change. In terms of physical distancing, listen, I've been very clear we need to follow the physical distancing guidelines, and if there are people not following the physical distancing guidelines, They should do so if there's any other events like the protests that we've had. We don't want to see a setback, and I'm encouraged that our medical officer of health has noted today that he has not seen a spike in cases due to the protest. I think it speaks to the fact that people were doing their best to wear masks and listen to public health. Thank you, Nitin. Our next question is Nida from The Pointer.
Hi there, good morning. Mayor Brown, last week you referenced some testing numbers for Osler, and earlier you said Brampton and Ottawa are fighting it out for who's doing the most testing in the province. Can you please provide the testing numbers in total just for Brampton alone, as well as what the city saw in the past 2 weeks?
So last week I said Osler Health was leading the province in testing, and I'm so proud of the leadership team at Osler Health. This week, I understand we're in close competition with Ottawa. We've gone from 52,000 tests to 61,000 tests. It's an extraordinary effort by those that work at Osler Health. And very grateful for their dogged determination. This helps public health immensely. I've asked for a breakdown specific to Brampton. Public health doesn't have that available yet, but Dr. Lowe tells me he's working on it. As you know, some people that get tested in Mississauga could be from Brampton. Some people that get tested in Brampton could be from Mississauga. People in Etobicoke being tested could be from Brampton. People in Brampton being tested could be from Caledon or Vaughan. And so there are, some overlap, but I'm going to have Dr. Lowe speak to the testing. The fact that Dr. Lowe and Dr. Mohammed tell me we're doing exceedingly well in testing is something that I take a great deal of encouragement in, because testing helps us determine where the virus is, helps us isolate it, and helps us with combating the virus. So Dr. Lowe can speak to testing specifically in Brampton and when we might get more data specifically by municipality.
Yeah, no, thank you very much, Mayor Brown. Thank you for the question, Nida. In fact, actually, Mayor Brown did come to me with this request, and I reached out to our provincial counterparts. As you can imagine, there are significant challenges with the data infrastructure that have been discussed in the news already, and it was advised to me that it would not be possible to provide a breakdown for just Brampton alone. There are apparently 444 different municipalities in the province of Ontario, and the presumption is that if you were going to do it for one, you should try to do it for all of them. And with the data infrastructure challenges and the ongoing pandemic response, my provincial counterparts have advised me that a breakdown specific to Brampton residents is not possible at this time. Now, they did say, however, that in general, they have looked at studies, they have looked at patterns overall, and most people tend to get tested at the hospital that is closest to their home. So to the extent that we have numbers from William Osler, those can be used as a close proxy for the testing that is occurring in Brampton. Understanding, of course, as Mayor Brown has identified, that some of those tests, a very small percentage or proportion of those tests, may be people from other jurisdictions. But in general, our understanding is that most people tend to get tested near and close to where they might be from. So thank you, and I'll pass it back to Mayor Brown.
Thank you for that. So if the reasoning behind it is that people are being tested closer to their home, how many people are being tested how many people have been tested in total in Brampton, as well as in the last 2 weeks?
Okay, so Dr. Lowe can repeat his answer that they're working on that, but I'll have Dr. Lowe speak to that.
Thanks so much, Nida. Like I was saying, I think it speaks to the idea that we need to go to William Osler's numbers because William Osler is the hospital that serves this large catchment area, and you can use the numbers as an estimate for what testing is being done in Brampton. So I understand it's close to 61,000 now. I understand, and I think more broadly the assumption then is you may have some Mississauga people that test at Brampton, but the presumption is there may be some Brampton people who test at Credit Valley, so those would theoretically cancel each other out based on just understanding of mobility patterns in terms of how people seek testing. I unfortunately, specific to municipalities, like I said, it would have to come from a data pull from Public Health Ontario, and they've indicated to me that given that there's 444 municipalities that'd be looking for this information and there's an ongoing pandemic response, that they're not in a position to provide that information at this time. Thank you.
And so, Nida, we have made that request, and hopefully at some point, I know they're really busy right now at the public health table provincially. We'll get that specific Brampton data, but I think all of us in the city can celebrate the fact that Osler Health, our hospital, has done an exceptional job in testing. They've gone above and beyond, and the fact that we're near the top in the province, either 1 or 2 every week, is something that I take a great deal of encouragement in, and as should residents in Etobicoke, because obviously Osler Health covers Brampton and Etobicoke, and I just want to thank them on behalf of the city of Brampton. We made it very clear that we wanted to be aggressive in testing. I spoke to the hospital CEO about, I said, use any of our city facilities. If it helps you test more people, he took us up on that offer. That's how we have the South Fletcher's drive-through center. And I have to say that the hospital has been great partners in helping us test more people in the city. We've got a great collaborative approach with public health, Osler Health, and the city of Brampton, and I hope that continues. So Nida, thank you for your question. And that wraps up this week's COVID-19 update. Next week on Wednesday, it's Canada Day, so we'll have a different time slot next week. But until then, stay safe, always adhere to physical distancing, and please wear a mask.